I wanna try and take in all the highs, embrace them for more than a moment's time. I want you, please don't move when I push you away. I know I contradict myself some days, but will you ride the lows with me?
Welcome to Mental Health News Radio. I am your host, Kristin Sunanta Walker. Our goal is to help discussions about mental health be a regular part of your daily life, no different than discussions about physical health. Mental illness can be a topic of discussion under the umbrella of mental health, along with so many other topics. This show is the original program on mentalhealthnewsradionetwork.com. Our network of shows are played in over 180 countries and cover more topics under that umbrella than you can possibly imagine. We were talking about mental health long before it became cool and popular to talk about, and thank goodness it has become so popular. We have incredible guests, advocates, patients, experts, people. Thank you for tuning in and enjoy our intro music, a song named Lows, written by Aubrey Toon. You can find her music at www.aubreytoone.com.
That night when I started praying, I cried, will you ride the lows with me? Will you ride the lows with me? When I'm down, my vision gets blurry.
Hi, everyone. Kristin Walker here. Today, our guest is Dr. Erik Won. He is the President and Chief Medical Officer of Wave Neuroscience. We're going to be talking about the brain today. Dr. Erik Won, thank you so much for coming on my show.
Oh, truly honored to be here. Looking forward to our conversation.
Yeah, I am too. And I'm always hesitant when I speak to someone and they have an organization in the business, because my listeners have been listening to me for so long that they know when I'm, in the past, when I've been doing a commercial, this is not a commercial, that you are doing incredible work. I've read everything I can get my hands on about you and what you're doing and your experience, which they've heard, somewhat, if I read everything that you've done, I would be on for 8 hours talking. It's quite amazing. But I really want to talk about this because I think in terms of mental health and mental well-being, a big piece of that has not been at the forefront, which is what's going on with your brain.
Yeah, I agree. And, I think, and it's not just us, I would say there is a movement and the whole community may be gravitating towards a more biologically informed approach. And so that's been our philosophy. We're using quantitative EEG and looking at areas of disrupted neural communication, and that tends to inform some of how we look at brain health and brain wellness. And it's really, I think, an exciting time. There's been a lot of innovation in the space. So,
have you seen an uptick since the pandemic?
Oh, yes. Yeah, it's sadly, I think the amount of depression has increased over 30% since the pandemic started. And combination of, I think, social isolation, anxiety, a lot of the kind of community that we're used to was rather acutely taken away. And I think now there's this reintegration process, which is good and healthy. But certainly, I think for I say us, but really the world,
right,
it's been a challenging time.
Well, just so we can start off right out of the gate on the right path, tell us, what is Wave Neuroscience? What does your company do, and why are you a part of this?
Sure. Well, so it's a translational neuroscience company, meaning we're taking a lot of the complex neuroscience being innovated and pioneered in labs and academic centers and translating it into technologies that are meaningful and accessible to consumers. And part of that, we have several different approaches, but the foundation is something we call quantitative EEG or electroencephalogram. it's a mouthful, but it's essentially a brain map. It's looking at how the different areas of your brain are communicating with each other, much in the same way an electrocardiogram is electrophysiologic imagery of the heart. This is electrophysiologic imagery of the brain. It's very portable and more easily accessible than, say, MRI or CT scans. And it's a little bit different in the sense that MRIs and CT scans tend to be snapshots. They're more still images, whereas EEG is taking over a time domain, kind of like a video dynamic imaging, where you can see where there may be disruptions in activity and areas for improvement. So we get this EEG, we run it through some neurocomputational analytics, and then we can help different areas of the brain to function better using an FDA-approved product called transcranial magnetic stimulation. Our contribution is personalizing that treatment protocol to each individual based on their unique EEG profile. And so that method we call magnetic EEG guided resonance therapy, or MeRT. But you can see it's several technologies sort of being synchronized together as a unified approach. And when we've taken that personalized approach, kind of honoring our diversity as a species, we've seen significant improvements in terms of the response rates and the magnitude of benefit that we see from individual to individual.
What's interesting about this to me, I love this because years ago I did just a week called a brain boot camp, following certain principles at the time. But what I found jarring to me, someone who's had early childhood trauma, and then, we've all had traumatic events, but just more on the severe scale. What I found disconcerting was that I went and I did this, and boy, did I notice a difference. It was incredible. However, there was no one at this center there that was a mental health professional. And so, wow, that was very hard. It was very difficult to have all of this go on, and then no one's there to kind of catch me emotionally, because of course those things are going to get stirred up. So why I wanted to do this with you is because you have that as part of what you do, and that's amazing to me.
Yeah, I think, as we sort of approach this as what is the best way to honor our patient populations and serve these communities best, I think that really the direction we're going, and I think the market is going, are approaching sort of combination therapies where I don't think any one approach, whether it's a medication or any other modality, can be viewed as a panacea or
Right.
This fixes everything. It's going to be rainbows and unicorns after this. It's I think that taking this in a manner where there's cognitive behavioral therapy and group therapy, whatever people are open to doing, whether meditation, yoga,
Nutrition,
actually, all these things are really critical. And if we ignore one area and tune up another, we may not be serving our patients the best. And so I think there's starting to be recognition of this. And I think the next 5 to 10 years are going to be very exciting in terms of how we're able to manage a lot of conditions that previously seemed intractable.
Right. I mean, I love this too, because you're walking in to deal with whatever it is you're dealing with, but you're getting a roadmap because of what you're doing, what you're utilizing technology for, to give you that roadmap of what's going on with someone's brain. I mean, what are some things that you see using the technology that you do, that just for the layperson, how does that help you know, okay, this is trauma, or this is this, because of what you're seeing in terms of a brain scan?
Sure. Well, a lot of it, what the patient comes in with informs us a lot about what the approach is going to be. But just to level set a little bit of how we look at these electrophysiologic brain maps, all of us have a dominant frequency with which our brain processes information. And we're exploring what's called the default mode network, which is what our brain is doing at rest. And we're looking for this alpha signal. And most people are between 8 and 13 hertz, which means they encode information 8 to 13 times per second. But if we see significant disruptions, sort of defined as more than 2 standard deviations away from the norm. So let's say in a hypothetical scenario, we have an individual who their alpha is 11 hertz, meaning they're encoding information 11 times per second. But they may have sustained blunt force trauma to the front of the head if they're in a motor vehicle accident, unrestrained passenger strikes the windshield, and we may see a cluster of neurons in the front of the brain that may be firing, let's just say at 5 hertz. And that type of disruption may manifest in a certain manner because of prefrontal cortex, his executive function, emotional regulation, and this person may feel lethargic and not wanting to get out of bed and lack motivation and have headaches. And if they don't have a bleed, anatomically, it may look perfectly normal. And so the recommendation traditionally may be, take some time off to rest, get some sleep, and, shake it off. And over time, a percentage of the population won't respond that way. Depending on the study, between 20 and 30% of mild traumatic brain injuries will turn into persistent post-concussive symptoms. And so when we see these neurons misfiring, first, many of our patients have told us that their healing journey started once they could identify the problem. Sometimes just visualizing it is really meaningful because it gives them a goal and a target.
Absolutely.
Of, okay, how do I make that better? And, there's many different mechanisms, but one of the paradigms in medicine is we've been engineered to be healing organisms. Whether you put 2 ends of a broken bone together, that can heal. If you put 2 ends of a wound margin together, that'll heal. And sometimes the brain and these neurons just get stuck, and we're giving them a friendly nudge in the right direction. And, so our approach is 30 minutes a day. And over time, we do see these neurons start to recognize that they want to be firing at their intrinsic frequency. And gradually over days to weeks, we see that improvement. And for those who may not be as interested in that approach, these other modalities, whether it's the contemplative arts of yoga and meditation, or a clean diet, a better exercise regimen, all those things can help. And so I think what we're seeing now, innovation in the space, there will be more and more approaches coming to the forefront that may help people along that path.
I like the idea of going somewhere that is open to, the approaches that have worked, in their lane, and having that come together in one place. Like you said, if someone isn't, agreeable to some kind of therapy, they may be agreeable to something else.
Yeah, absolutely. And people are open to different things. We're all unique in our own way. But one of the things that we found, even for, my background, I have a lot of military friends and colleagues who served. And for those who may be struggling with post-traumatic stress, even when they're feeling better, there's a lot to unwind. And so I think it's really just the beginning. If they're given some clarity of thought and are able to manage things better and are sleeping better, many of them they now have the clarity to say, okay, I need to really engage in marriage counseling. This is something that I want. And and we've heard from many therapists that whatever happened, they can listen now without going from 0 to rage in a heartbeat. And so I think this is a foundational building block, but it's not the end, right? And so this is, I think, part of the healing journey, and one piece of the puzzle, but it really takes a village, so to speak, to fill that picture.
Let's talk a little bit, and a lot of people, and my listeners certainly, because I've had other guests come on and talk about TMS. Can you talk about the difference? First, pronounce everything, because I won't do that well, and and explain how that differs or is the same as what your technology is.
Sure. Yeah, there's it's a bit of an alphabet soup. There's a lot of acronyms.
Right.
But TMS or RTMS, it's very common. Most people can find TMS in their cities. It stands for Transcranial Magnetic Stimulation, or repetitive transcranial magnetic stimulation. And it's more of a one-size-fits-all approach, but it's FDA approved for treatment-resistant depression. And so many insurances will cover transcranial magnetic stimulation, which is wonderful. And there's really good data. It's been around for well over a decade, and it's to treat depression. And treatment resistant, the definition is failing 2 pharmaceutical drugs in 2 different classes. And so there, I think, is increasing evidence to suggest TMS may be a frontline therapy rather than for just treatment-resistant depression. But there's more research to do, I think, before we get there. But the repetitive, the RTMS just refers to both the pulses being repetitive, but also doing this on a day-to-day basis over weeks to months.
And just so people get like a picture in their head, what does that treatment look like? Are you, I know, but I'm asking the question for our listeners. Are you hooked up to something? Do you do this at home? Do you do this only in a clinical setting? What does it actually look like? Yeah,
so they're not big machines. They're about a 2 foot by 4 foot footprint. There's usually a base. There's several different TMS devices out on the market, but there's usually a base, and then there's a coil that is connected by some wires to the base, and the coil is usually going to be somewhere near your scalp and provide stimulation. And I want to differentiate. This is not the same thing as electroconvulsive therapy, which is
right.
A much higher energy, high wattage type approach. That certainly has its place. I'm not trying to diminish the value of ECT. I think that is very helpful for many people. But this is a much milder, gentler approach. Does not require any kind of anesthesia. Many of our patients have told us they characterize it as a brain massage. But there's pulses that you feel on the forehead, and you can navigate to different areas of the brain, but most of the industry is treating at what's called the left dorsolateral prefrontal cortex. It's the left forehead area. And typically there's 6 seconds of pulses. We call that a train of pulses. And then there's going to be about a minute of rest, and then you'll feel some pulses again. And it's you just sit in a comfortable chair, and typically they're going to administer the treatment with, they call it a wand. There's some other devices. There's a BrainsWave that looks like a helmet, and then there's a neuroanalytics where there's an arm that comes around and places the stimulation in a specified area of the brain. But it's not, the magnet may confuse people. You don't go into a tube. It's not like an MRI.
Right.
Yeah. And this threw me off at first. When I first heard magnet, I was a bit skeptical because, there's little trinkets around. This is actually a pretty powerful, it's an MRI grade 1.8 Tesla magnetic coil. But instead of creating a 3D image, it's actually providing pulses. And the first order principles of physics, there's something called the Biot principle, where magnets can deliver energy across a solid barrier. And so we have this 1 centimeter piece of skull that stands in the way of, there being any kind of conductance inside the brain. And right. This can actually elicit and evoke potential in neuronal tissue without there being any kind of surgery or scalpel. And that's sort of the novel approach, or the innovation, is that we can leverage those principles. We call these neurophysics principles now, and actually with fairly good precision, cause neurons to discharge and fire in a prescribed manner. And so in the scenario we were talking about, where we talked about an 11 hertz brain and it firing too slow, in a different scenario, let's say in the right backhand side of the brain, our visual cortex, if it's firing too fast, let's say at 30 hertz, we're oversampling our world. We're scanning our environment 30 times per second. But if the rest
of our my brain.
Yeah, and it's not uncommon. Many people, this is what we call beta. Like we see activity that may be too fast, and a lot of overachievers or people who may be fast processors are prone to anxiety.
Yep.
But we provide we call it stimulation, but it'd be inhibitory stimulation, where we ask those neurons to slow down. And when we do that, if we give the brain these friendly reminders, it entrains that neuronal tissue to slow down. And then gradually over time, the body does the work for us. And then it starts to resynchronize, and we see people gradually improve over time. And that's really our goal. We're sort of tapping into the body's intrinsic healing mechanism. We're not overpowering the brain with a lot of energy. We're just giving it these daily reminders, and then we see this process take place over time.
And you're not making it so your patients are now they cannot function without getting this kind of therapy. The goal is for their body to be able to take over and do this on its own.
That's right. Yeah. So there's been good durability of treatments, and from our first clinical trial, we're over 4 years out, and still keep in touch with many of the subjects who are in that trial who continue to do well. And, we talked about this being the beginning of the healing journey. And many people, I think, start to endorse different behaviors because they don't want to fall back to where they were. And so
Right.
whether it's protecting their sleep, and I think sleep is fundamental to so much of what we do, or changing up their diet, changing the people that they spend time with. Those are important, I think, to the longevity and long-term wellness of really everyone. But yeah, I think when we do those wraparound, making sure people are endorsing good, healthy behaviors, that's really a requisite approach to ensure that people continue to do well in the long term.
Right. I was just thinking of all of just my show in particular, and then there are 8 other shows on my podcast network that focus on being in an abusive relationship, someone in a relationship, a long-term relationship, or many with people who are diagnosed with narcissistic personality disorder. Not that I'm putting that down. I'm sure narcissists can benefit from this treatment as well. However, I think anyone that has been in that kind of trauma, the gaslight, all these things that you're dealing with, the heightened sense of what's going on and how your world is being turned upside down. Boy, what a great place to go to get help when your brain and your body are in so much trauma, to work with your group to kind of help you out of that process so that you're not living with this overactive emotional state all the time.
Yeah. It's always, I think, an honor and privilege to walk shoulder to shoulder with patients who are really on this journey. And I have to sort of acknowledge, coming from my initial approach to this. So we have an FDA trial ongoing. It started with U.S. Special Operations Command, and we've now moved over to incorporate civilians. Thankfully, with the Texas A&M chancellor had recognized that there's a lot of potential for the trial, and a group called the Data Safety Monitoring Board that monitors this trial made a recommendation to us that we should open it up to more than the military. And so because it was sponsored initially by the Department of Defense, it was a military population. What I didn't recognize, and I think it is a really important data point, veterans in the military are not the largest population struggling with post-traumatic stress.
Right.
It's really dwarfed by sexual assault survivors are really the largest community. And if we're not helping out these communities, we're doing everyone a disservice. And so we've opened that up to civilians and the wider population, and hopefully able to impart some benefit and healing to these populations as well.
Absolutely. I mean, and then, you don't help these populations that have experienced these kinds of abuses. Then, they're having, then we get into generational trauma. You're opening a whole, Pandora's box of things that, that are going to continue on and on and on and on and on. So I love your approach, the whole body that includes your brain as well. What does it look like if someone's, listening to this and they say, oh my gosh, I'm really struggling. with my mental health. I'm struggling with so many things. It could be diabetes. It could be, I was reading on your website, it could be so many different issues, as well as their mental health, trauma, all kinds of things. How would they go about finding you? What does that look like when they do find where one of your offices are? And I want to get into what people can do at home, or if you're working on something that isn't always an in-clinic setting.
Yeah, so we have over 70 centers now around the country,
Amazing.
and we're in some other countries as well, Australia, Peru, Panama. So we've got a growing footprint. And so if they come into one of our centers, they're sort of designed to be very warm and welcoming. We try to make it feel more like a spa than, I guess, a medical center or a clinic, while maintaining, I think, a lot of those high clinical standards and rigor. But it starts with the EEG, and really just it's a 10 to 30 minute study, depending on whether there's different EEG devices. There's a wet lead and a dry lead device, but getting the EEG and having a conversation with one of our clinicians is sort of the start of it, and then it'll start to take shape from there. But that really informs us of how people are experiencing the world and how we might work together to improve any disruptions in activity that we're seeing. So those are some of our centers, and we're starting to innovate, realizing if we're true to our mission and charter of trying to make this accessible to everyone, we're starting to innovate a portable device. It's called the Sonal, for the 5 letters in the middle of personalization. And we're starting to move that into production. And I think we're still a quarter or two away from that being widely available. But it's exciting to see.
Absolutely.
Yeah, that kind of capability. But yeah, we're excited about what's to come.
I am too, very excited. And I've been, obviously you're way more steeped in it than I am. I'm just a consumer, but just being that I do podcasting and I've interviewed so many different people and watched different technology come in, and this is the next greatest thing, that's going to help everyone with mental health. And then, it's sort of like the flavor of the month thing. And I've tried many. And like I said, what I love is that this is incorporating the whole person involved in this. It's not just a test or a just sitting down to do therapy. All those things are fantastic, but combining together. But also, when you are working on the brain and you are dealing with trauma, you really do need people around that understand how to catch people as things come up during this kind of therapy. So I appreciate that as well.
Oh yeah, absolutely. Yeah, if there, sometimes there's an awakening and there has to be resources around where that person has somebody they can speak to that's knowledgeable and experienced in the area. And so I think that sort of a combination approach is really critical. And so yeah, I think an important and valuable point that you bring up. If we're serving our patients the best way, we're making all those resources available.
Absolutely. Well, tell our listeners where they can find out more about you and your company.
Yeah, so our website is waveneuro.com, just how it sounds, WAVENEURO.com. I'm not as involved on the social media side, but we do have Instagram and I believe Facebook presence. And so they can read about us there, many of our clinical trials, and data is also available on those websites. The clinical centers are, I believe, listed as braintreatmentcenter.com. And so there's always a separation of church and state between a biotech company and then the clinics. It's called the corporate practice of medicine, but there's good ethical reasons why we try to create that separation in the sense that we don't want any physicians to be incentivized improperly. So they can always do the right thing for the patient without thinking about a technology or a pharma or anything like that. And so we like to approach it that way. But yeah, waveneuro.com, breaktreatmentcenter.com. And yeah, hopefully, if anyone is open and interested, they can look at those resources and make the decision that's best for them and their family.
Absolutely. And if you're hooked on social media, they can help with that too. That's a whole other show.
Yeah. No, that's I have 5 children, and certainly it's something we discuss as a family all the time. It's I don't want to sidebar.
Because dopamine, okay, and so many other things. Look at what my child is doing to themselves right now. This is not good.
Yeah, we really could do a whole podcast on that.
Absolutely.
Yeah, I don't want to go on too much of a tangent, but there was this discovery recently about how the pain center, reward center of the brain, the anterior cingulate cortex, they're co-located, and it's not 100%. It's not completely binary, but it's hard to have one switch on without the other. And so, for example, when you have complete euphoria, when something great happens, you tend to forget about your pain. And when you have extraordinary pain, you tend to forget about all the joy. There's this black void. And so when we think about that type of brain physiology, and then we think about how social media, some of our best and brightest are working at these companies to make these algorithms as sophisticated as possible so that we adults and our children get a constant dopamine hit. It's almost an unfair battle, right? Like they're so smart about making this addictive, and
it's like candy. It's like sugar. It's just a technological version of sugar addiction. I mean, I'm simplifying it totally, but I mean, that is how, so yeah, exactly. A whole other show. Maybe we'll go on Dr. Loretta Bruning's the Happy Brain podcast, and you two can ping back and forth about that. But Dr. Erik Won, thank you so much for coming on the show. I absolutely appreciate it. And listeners, I cannot tell you enough. Many of you that are, dealing with trauma, this is a place to go to help you on that journey. So I'm so glad that you agreed to come on the show, Dr. Won.
Thank you. I truly appreciate your time.
And listeners, thank you for tuning in to another episode of Mental Health News Radio.
But will you ride the low, low, lows with me? Will you ride the low, low, lows with me?
One thing you can always count on at Mental Health News Radio Network and my show is that there will always be dogs around. Why? They are natural healers, excellent for your mental health. The original therapy dog Miles has something to say in just a moment. For now, please check out all of our amazing shows at mentalhealthnewsradionetwork.com and all your favorite podcast apps. Until next time, I'm Kristin Sonanta Walker, and thank you for listening.
And I can ride the low, low, lows with me. I can ride the low, low, lows with me. Till my vision clears up perfectly. I can ride the low, low, lows with me.
Good boy.